everybody. We have Mr. Sree from Mastec. He is the SVP and the Global Healthcare Head. So, sir, welcome. Good evening.
Thank you.
How are you feeling regarding the event?
No, I think it's been a great event that's got organized. It gets us level set in what's happening in the industry and also gets a feeling of how healthcare is shaping in India as well as in global, right? Mastec is doing a lot of good work across healthcare and life sciences globally, and it also level sets the playing field for us.
So, what do you think? So, till what extent is healthcare considered seriously in India as compared to the Western countries?
Yeah, I think healthcare in India, if you look at it, India by size of the population is huge. It's probably one of the largest markets for healthcare. But I think the challenge is, as far as healthcare in India concerned, is more about two or three things, right? One is awareness, making people aware of what's existing in either in a hospital or the other setups is very important. Second is adoption, because in India still a lot of things are mandated, a lot of things are optional, not mandatory, unlike the Western countries. So it's very important for government to take initiatives to make people aware and make people adopt as far as healthcare, right? So, but as the market is huge in India, a lot of potential to expand that into rural markets too, right?
Speaking of rural markets, till what extent are the people in the rural markets skeptical about it, or are they into it?
No, I think if you look at rural markets, I think the literacy rate of people in the rural market is not on par in compared to the urban areas. So I think again it is important for the people to be made aware and knowledgeable. India as a country is more focused on outcomes. So while government has introduced a lot of digital healthcare programs like ABA and ABDM, I don't think many people are aware of it. Rural areas, people would be asking, okay, if I'm going to get a health ID, will I get money for that, right? So everybody is bothered about outcomes. I don't think they are aware that the health ID is as good as money in a different form in their account, right? So it's important to make the rural markets and rural segments be aware of what's available. Second, I think a lot of healthcare organizations are doing a lot of technological innovation, whether it is telemedicine or whether it is tele-based services, which covers a lot of rural patients. Right? So I think that spectrum is expanding, but still awareness and adoption needs to improve.
Right. True. For concluding the interview, I would like to ask you, what are your suggestions for the youth who wants to come into the healthcare field?
Yeah, I think again, healthcare being a massive field, lot of options for the youth. You have the standard professions, going the MBBS and MBBS route. There is still a shortage of nurses. So nursing community is also picking pace in terms of what's happening. Technology in terms of medical health is also a great option in terms of many of the youth joining technological organizations, doing a lot of innovation. So the options are umpteen. You don't have standard courses like what you had. I mean, like even BSc, you have a lot of variants. You don't have an engineering and a medical variants that used to happen. Now people have a lot of variants, so options are unlimited, right?
Right. Okay, that's it for today.
Right.
Thank you so much.
Thank you. Appreciate your time.
It was great having you.